Hello, I'm Helena Grant. I'm a senior analyst at Petauri Evidence, and I'm excited to talk you through the results of my ISPOR poster exploring reasons for the increase in terminated NICE appraisals. So it's been reported that the percentage of appraisals submitted to NICE but terminated by the manufacturer have increased in recent years. So what we wanted to do was a deeper dive into the reasons behind the rise in terminated appraisals to understand what sort of trends are happening in the UK HTA landscape and potential challenges that manufacturers have been up against. So to do this, we reviewed every terminated appraisal and looked at the categories and reasons behind it. So these fell into 6 broad categories covering clinical evidence limitations, economic evidence limitations, administrative factors, decisions to focus efforts and resources elsewhere, challenges demonstrating how the technology would be implemented in the NHS, and also no further reason given. We then use these categories to assess the proportion of total terminated appraisals, look at trends over time, and also look at how the reasons for termination might vary across indications. So what we found was that on the whole, 40% of all appraisals terminated between 2008 and 2025 were due to economic evidence challenges, closely followed by evidence limitations and decisions to focus efforts elsewhere. Then when we looked at how these reasons changed over time, we saw that the greatest increase was also in cost effectiveness challenges, and that the reasons for termination for the other categories sort of showed a bit of a decline. We then tested this with a simple linear regression and saw that there was a statistically significant reduction in the number of terminated appraisals due to clinical evidence limitations, but the changes over time for the other categories weren't statistically significant. We then looked at the 4 indications with the most terminated appraisals, which were endocrine, nutritional, and metabolic diseases, oncology, blood and circulatory diseases, and immune system diseases, to see whether there were any sort of trends or patterns relating to specific indications in the reasons for termination. Upon looking at the graph, you can see that trends are broadly similar. Maybe a couple that stand out are the fact that nearly 1/3 of endocrine, nutritional, or metabolic disease appraisals were terminated due to NHS implementation challenges, which is larger than the other 3 indications. And similarly with immune system diseases, 41% were terminated due to the manufacturer deciding to focus efforts elsewhere, which is also greater than the other 3 indications. So what does this mean for manufacturers pursuing NICE reimbursement? Our analysis generally signals challenges demonstrating the economic value of products, and manufacturers seem to be identifying early that they might not be able to quantify the economic value of their product before going further down the path of the HTA submission. Some potential reasons for this might be the rising prices of innovative products balanced against a more genericized landscape, as well as the fact that the cost effectiveness threshold has held constant over this time period as well. On the other hand, the decline in terminations due to evidence and NHS implementation factors shows improvements in understanding how a new medicine might integrate into NHS clinical pathways, showing that it is worthwhile investing in this understanding ahead of HTA submissions to ensure that the value of the product within the NHS can be clearly demonstrated. On the whole, the research shows that economic evidence standards and challenges could be preventing or delaying access to new medicines, which may feed into some of the ongoing debates and discussions about the level of the cost effectiveness threshold. and how this might change in the future. We're excited to share these results at ISPOR, and our HTA experts will gladly be there to answer any questions that you might have about some of these ongoing changes in the HTA landscape in the UK. Thank you.